I'm Meera Bahadoosingh, and I had a stroke on February 18th. When I woke up that morning, I knew something wasn't right. I kept losing my balance and stumbling, and my face felt numb. But having a stroke wasn't something on my radar. I'm a healthy 26-year-old who works out and eats well. But a stroke, along with many other serious health problems, can happen to anyone. I was lucky. Dr. Adams at the Victoria Hospital highly recommended my admission to Riverview Health Center's stroke rehabilitation program. That unit was my home for 4 weeks, and without the therapy and care I received there, I wouldn't be walking today. I'm now nearly fully recovered and back living independently in my apartment. I'm also back to work full-time. I give credit to the care team on my unit for helping me achieve these successes. I'd like to share my enthusiasm about Riverview Health Center with you. So come with me and I'll take you on a tour of this progressive healthcare facility that provided me with such compassionate, encouraging, and successful treatment. Located on parkland overlooking the Red River, this 388-bed facility is on the cutting edge of rehabilitative and medical care. While my health issue was a stroke, the center also provides care for many other conditions, such as acquired brain injury, Alzheimer's disease, cancer, and respiratory disorders. Care is provided through both outpatient and inpatient programs. The day hospital provides therapy on an outpatient basis for people who require ongoing rehabilitation so they can continue to live in the community. The center is home to 8 inpatient programs, and palliative care is one of these. Many of you may already know what it's like to lose a loved one to a terminal illness such as cancer. But on Riverview's palliative care unit, the emotional and physical pain that goes along with these illnesses is addressed with compassion and dignity. Another important area of care is geriatric rehabilitation. This program assesses, treats, and stabilizes patients who have more than one major age-related medical problem. For those whose medical needs are too comprehensive for a personal care home, Riverview offers the Chronic Care Program. Their staff aim to enhance functional levels and quality of life for their patients. Riverview is renowned for its 10-bed acquired brain injury program. The program offers a holistic approach to help patients and their families face the tough physical and psychological challenges of brain injury. Respiratory disease can be frightening and debilitating for those who must live with its effects. The 14-day inpatient respiratory rehabilitation program educates patients about their disease so they can manage their symptoms with confidence. The incidence of Alzheimer's disease and other dementias is on the rise. Here in Manitoba, almost 19,000 people are affected by these life-changing conditions. On Riverview Health Center's Special Needs Unit, people with memory problems can live in a personal care home setting safely and comfortably.
Our primary goal on the Special Needs Unit is to manage and minimize some of the anxiety and behavior that are associated with dementia. One of the ways we do this is through enhanced recreation. Our patients truly benefit by participating in the purposeful activities facilitated by our recreation staff. Environment also plays a key role. Inside, we have wayfinding cues and a continuous circular corridor for those patients who wander. Outside, an enclosed wanderway that was funded through the Riverview Health Center Foundation provides an opportunity for sensory stimulation and horticultural activities, all of which help to minimize anxiety and enhance quality of life.
There comes a time in some people's lives when living independently is no longer an option. If a loved one needs more help in their own home than they can manage, then Riverview's Health Center Personal Care Unit is a welcome solution.
For the people in personal care, the unit becomes their new home, so we have created a warm and inviting residential environment. Every resident has their own room, and we do our best to allow people to maintain their own routines. Social interaction with visitors is encouraged, and residents have ready access to many on-site community services, such as a library and a hair salon. Our staff keep quality of care at the forefront. We offer a continuum of professional care services and can assist people who need complete care with daily living activities. We always work to promote independence through various therapies, including music, art, and recreation activities.
I have personal experience with Riverview's stroke rehabilitation program. When I arrived there, I was in a wheelchair and was very weak. I had numbness in my face and hands, and when I was tired, the left side of my face would droop. At first, I felt overwhelmed at the thought of staying at a stroke unit, But it didn't take long for me to realize that the whole care team was my own personal cheerleading squad.
Like all the other programs at Riverview, care in the stroke unit is provided by an interdisciplinary team of staff, from nurses and physicians to pharmacists and social workers, all play an integral part in a patient's care. On our unit, patients like Meera, who have recently suffered a stroke, participate in an intensive short-term rehab program that promotes recovery of functions. Every member of the team helps the patient to regain their independence so they are able to live in the community again. Key team members in Meera's rehab program at Riverview are the physiotherapist, the occupational therapist, and the speech-language pathologist. The work of these therapists is closely intertwined as they all work with patients in the areas of neurological, geriatric, and cardiorespiratory rehabilitation. Physiotherapists work with patients to treat movement problems and to facilitate normal functioning. Therapeutic exercises and various treatment modalities are used to help the patient develop strength, balance, exercise tolerance, and improved range of motion. The expertise of the occupational therapist is also vitally important to successful rehabilitation. The goal of OT treatment is to promote a person's independence and functioning and activities of daily living, whether it be getting dressed in the morning or cooking a meal. Teaching patients how to use assistive devices such as specialized cutting boards as well as conducting wheelchair assessments are also part and parcel of an OT's role. Speech-language pathologists diagnose and treat disorders related to communication, cognition, and swallowing. They use special instruments and assessment methods to analyze and diagnose the nature and extent of impairments. Once again, the goal is to help patients develop or recover their skills so they can fully participate in all aspects of their lives.
The therapies and programs that you have been hearing about were, for me, the link back to my life. I can't thank Riverview and its people enough for not letting me give up on myself. The care was amazing and everyone was so positive, no matter what their role in my treatment. I felt that everyone from the nurses to the healthcare aides were rooting for me because they always had genuine smiles of encouragement to help me through the tough times. Take it from me, Riverview Health Center is a facility to watch as its reputation for high-quality care, specialized health services, cutting-edge technology, and a commitment to research continues to grow. With exciting new developments soon to be announced, there's no doubt that Riverview will move forward into the 21st century as a leader in healthcare.